Now let's discuss Chapter 5. We're going to take a few minutes to review medication errors, how to prevent them, and how to respond. So, an adverse drug event is a general or more global term which can include medication errors. It can also include adverse drug reactions, like allergic reactions or idiosyncratic reactions. Your textbook talks about the work at the Institute of Medicine and the studies related to the medication errors. In 2006, the Institute of Medicine indicated that at least 1.5 million Americans are injured each year by medication errors. So since that time, statistics have ranged from 98,000 a year to 3 million preventable errors a year. Regardless, errors are happening, and one error is an error too many, right? So let's talk about what the errors are and how we can work as nurses to help prevent them. Adverse drug reactions are not always preventable, but can occur as a result of a medication error. An allergic response can range from a slight rash to a life-threatening anaphylaxis, whereas an idiosyncratic effect or idiosyncratic reaction is when the medication responds opposite or in a way that's not expected based on what we know about the drug. Medication errors are when we have a preventable event. They are errors regardless of whether or not the patient is harmed. So medication errors are a common cause of adverse outcomes in healthcare, and the National Institute of Health suggests that these errors cost about $20 billion across all healthcare settings each year. So when we look at these events, we see these as a common reason that people are hospitalized, a common reason for emergency room visits, and they're not just happening in the hospital, but 75% of all patients who are hospitalized have an error or what we call a close call. You used to hear it as a near miss. We'll talk about those in just a few minutes. Errors can occur at any step of the process: procuring the medication, prescribing, transcribing, dispensing, administering, or monitoring. Now, most of the errors that you're going to see as a nurse will occur in the administration of medication. The number one reason that errors occur in administration is a result of distraction. It's really important that as a nurse, you learn to focus on what you're doing when you're doing it, and particularly when you're administering medications. Some other issues that can contribute to errors are organizational issues. So this is where we'll see systems administration put into place in the form of things like barcode scanning, computerized order entry so that we're not struggling with providers' handwriting, and computerized drug interaction checkers for both prescribers as well as pharmacists. Educational system issues can occur as a result of nurses or other people who are involved in medication ordering, administration, or preparation when they don't keep up with the best practices or they don't have access to current information on medications. It's really important that you check orders and be comfortable with what you know about medication before you administer it. Don't pretend to know everything. There are almost 7,000 drugs on the market in the United States, and we cannot know them all. We must take time to look up those that we do not know. Now, some sociological factors that contribute to medication errors include the culture of the work environment. This can be things like being interrupted when you're doing your medication pass. Disruptive behaviors. Is the culture where you work one where you do not feel comfortable talking to the pharmacist, or maybe you're not allowed to question a provider? If so, there's a dramatic increased potential for error. Now, as a result of the Institute of Medicine studies, you will find that many of our cultural aspects in the workplace have changed, and most of the facilities are in a non-punitive way dealing with medication errors. When we look at the types of medication errors, there are different types of medication errors. We have what is called a close call. Now, we originally called this a near miss, but that was sort of a misnomer since there really was not a near miss, but a near error. And so no error is now called a close call. This is when we have an event that occurred but was captured before it actually reached the patient. Some facilities, these are not reported, but they really need to be reported because we want to fix the problem that was allowing this or going to allow this error to occur. And so we can't do that unless we know about it. So by reporting it, it allows us to correct the problem. Of course, medication errors can occur that do not cause harm to the patient. There can be a medication error that causes harm or disability, maybe loss of a limb, for example, with the IV medication. Medication errors can also result in death. So how do we prevent medication errors? There's multiple systems of checks and balances that we use, making sure that we use legible and correct orders, asking for the information, and using appropriate consultation with the provider or with the pharmacist. Checking your medication order 3 times. We check it when we look at it the first time to get ready to prepare it. We check it as we're pulling it out of the medication drawer or the Pyxis or wherever we're getting it from. And then we check it again at the patient's bedside. Also, I suggest that you check it before you throw away whatever you are using to give that medication. For example, you'll find unit dose packs. We'll talk about those more in clinical, but that extra check at the end is actually a really good way to check as well. Then following our rights of medication administration, that's important. Your textbook has a great box that lists strategies for preventing medication errors. I would suggest that you look closely at those and try to incorporate those into your practice. Minimizing verbal or telephone orders. When we look at the place that orders are one of the other places where errors occur, it's in transcription. We want to be sure that, first of all, you know your facility policy on who can take telephone orders. When you're required to take telephone orders, be sure that you repeat the order to the prescriber. There's a lot of times that we don't have good connections, that people are now talking in different environments. We have access to the cell phone and different places of communication all over at any time, day and night. So spell the drug name out loud, speak slowly and clearly, and make sure that you have the right order. You want to be sure you're listing the indication or the rationale for it next to each order. And avoid medical shorthand. That includes abbreviation or acronyms. For example, MS, is that morphine sulfate? Is that magnesium? Is that multiple sclerosis? Make sure that you're not using those abbreviations. And we had a list of those that you were to review last week. So be sure that you're familiar with those that do not use abbreviations as well. Never assume anything about the items that are not specified in an order. For example, don't assume that it's an IV drug or that it's a PO drug. Don't hesitate to question a medication order for any reason at all if you have any doubts. And never try to decipher illegibly written orders. Contact the prescriber for clarification. Some of the things that we will cover, or have covered rather, in LVN 111 are medication errors related to calculations or related to transcription and writing out the order. We never use a trailing zero. Do not, for example, use 1.0 milligrams. Instead, just 1. The 1.0 could be misread as 10, and then we have a tenfold increase in the medication. Always use a leading zero for decimal dosages. For example, not using 0.25, but using 0.25, because that could be misread as 25 milligrams. So then you have a huge dosage error, right? Take time to learn special administration techniques. If you are not familiar, continue your education. Always verify new medication administration records. For example, some of you are going to work in long-term care, so you're going to verify monthly orders at the end of every month. If you see something that doesn't look right or that wasn't there before, Make sure you verify that. Get clarification from the provider. Another thing is always listen to your patient. The patient may know. If they say something like, I don't think so. That's not my drug. I've never taken lisinopril before. They have a question. You have a question. Honor their concerns. Verify the orders. The other thing that happens is sometimes the provider comes into the room and says something to the patient, is interrupted, gets to sitting down to writing the orders, and actually forgets to either discontinue or order a medication or change a dosage on a medication. Providers are human too, right? So always listen to your patient, verify if there has been a change. Check the patient's allergies, check their identification. We require 2 identifiers, one being name, and usually we use date of birth or another type of number. For example, the veteran system uses the last 4 digits of their social. So that'll be unique to whatever facility you're working in. Your barcode scanning is not considered an identification, just in most facilities. So be sure that you're using 2 alternate forms. When we report medication errors, first and foremost, take care of your patient. You need to report, but your first priority is to the patient and the patient's safety. So report per the policy, report it to the prescriber, report it to your nursing management following the facility policy. Document the error per the policy and procedures, and remember that these errors are not included in the medical record. You'll have some sort of an incident report, and you want to give facts only: the medication administered, the actual dose, the observed changes in the patient condition, and the prescriber notified or follow-up orders are things that may be put into the chart very clearly based on your facility's policy, but not that a that a incident report was filed. Okay. There are also times that a medication error may require that we report it to an external entity like the United States Pharmacopoeia Medication Error Reporting Program, or the FDA, or the Institute for Safe Medication Practices. Sometimes the Joint Commission will be required to be notified. So that will be something that you will not report directly, but based on your facility's policy, someone is going to walk you through that process if you have need for that. Now, what is medication reconciliation? It is this continuous assessment and updating of a patient's medication information. So we verify, we clarify, we reconcile. And this includes all medications. So don't forget to add herbals and over-the-counters in this process. This reconciliation occurs at different times. It should be done at each stage. When we admit a patient, when there's a status change, if we transfer between facilities, even between units, between teams, and then again at discharge. So this helps us to be able to see what is done and what changes have been made, what things might have occurred, and also to keep the medication list straight. So notification of patients, there's some ethical issues besides when we think about this. The provider is required, obviously, to disclose when an error occurs, but remember that you want to stay within your facility policy and procedures. So find out what this is prior to the disclosure. Actions can include disciplinary action from your governing board, suspension, loss of your license, a civil or criminal charges, but for the most part, like I said earlier, agencies have moved to a non-punitive environment. Now, in 2003, I had the opportunity to listen to a lecture from Sorrell King. Sorrell and Peter King came to St. Joseph Hospital in Denver, Colorado, and I was a nurse educator there. You could probably tell I'm already getting a little teary-eyed, but I'd like for you to visit the website that I have posted to listen to just a little excerpt of the Josie King story. Talk to you soon. Again, if you have questions, please feel free, email, text, call, or post them up on the discussion forum. Talk to you in a bit. Bye.